This conference will now be recorded.
Oh, okay. So your OB rotation involves a lot of education on, of course, mommy and baby, and they go through different types of things that you should know as becoming a nurse. Of course, this is a specialty area. So if it's not something that is a love for you, you may not want to go into OB as being or a labor nurse as your specialty. Some of you like ICU, some of you may like the ER. It just depends on what works for you. And you'll know that as you go through your rotations and you're exposed to clinicals on the floor. I know that my love, when I first walked on the floor for labor and delivery, that was my love. I am an adrenaline junkie coming from New York. I like everything done quick, fast. So that's exactly what it was like. It reminded me of the ER. Although the ER was not my love was to bring new life into the world, because I feel that is a very special gift and is a wonderful thing to experience. If you do decide that you would like labor and delivery and to be a labor nurse, I will tell you, you will wear many hats and learn. You will have a vast knowledge of a lot of different areas in the hospital. When you walk onto a high acuity labor floor, you are exposed to what is called an OB triage. Just like you would be triaged in the ER, you would be triaged here in OB. You would be pregnant mommies. You would also be an OR nurse. So you would learn everything there is to know about the OR if that's your desire. And you would learn instruments and sutures and what the surgeons need, so on and so forth. You would also become a PACU nurse because you would have to recover your patient after the OR. I don't know if you're learning about high-risk mommies, but you would also be exposed to that. So you would have to make sure you would be up on your skills on taking care of mommy. Also, you would be a baby nurse. So there are a lot of different hats that you wear when you're a labor nurse. You're not just delivering healthy moms, healthy babies. You will come across lots and lots of different things if this is your desire and what you want to do. I know they teach you the basics about a strip and what to look for in a fetal heart rate. You would learn more if you became a labor nurse. You would be trained in this area. You would also know how to resuscitate a baby. So right now, excuse me, right now you have your ACLS and BLS. So you know how to take care of mom. And for adults, we always know that it's circulation first. For a baby, it's always airway. So you would be certified in NRP, and you would learn how to resuscitate a baby. You would also learn the uses of magnesium and what magnesium does on a laboring patient that is a primip, that is in labor with some contractions that they need to slow down, or somebody that's ruptured. We call that SROM, early. So there are all different aspects of becoming a labor nurse. If you choose to go into OB, or even a NICU nurse, you would be trained on, of course, babies, preemies, and postpartum. Postpartum is, we call that our happy area, because you're taking care of happy baby, happy mommy. So does anybody have any questions for me, or anything that they would like to ask me right now that I can answer for you about OB, if that should be your desire? Nobody?
How do you handle like the death of like a fetus or even a mommy?
Okay, so what happens is we do deal with fetal demises. We do. And that is a very tough part of the job. And that would be in any aspect of nursing, you would have to deal with death. Honestly, from my experiences of dealing with mommies that do lose their babies, the best thing to do is to be a support, is to stay and listen, is to hug that mommy, hold that mommy. Make sure that when that baby is born and mommy wants that baby in the room, you treat that baby as if that baby is alive, and you let that mommy hold that baby and comfort her. And that is what you do. I know from being there, sometimes I cry with them. If they want to cry, I cry. If they need me there as support or direction on what they should do next, I am there. So you are also going to be that type of a nurse, and you are going to help them through the most difficult time of their lives. I will tell you that we sometimes deliver babies that are full term that just come out and they're not breathing, and they look like little dolls. It's very, very difficult. But you're strong, you hold on, and you're there for them. Remember that. And you put your feelings aside, and you put your love and everything you have inside of you with that mommy and that baby that's there, that life that was taken. And that's all. If they want you to pray with them, I absolutely pray with them. So you're a support system too.
Phenomenal. Thank you.
You're very welcome. Does anybody else have anybody have a love for OB or labor and delivery? No? What do you got? What do you want? What are you looking to go into? Who wants the ICU? ICU. Who wants ER? No one wants ER. Who's just going to go into med surge? OR? Anybody for the OR? Okay. Okay. Well, remember that OR is a wonderful thing also. You learn a lot in the OR. You learn to stand strong. You are the boss of that OR. You are the circulator. You will be calling the shots.
Thank you for saying that. Yeah, we discussed that in the when you were watching the videos about the operating rooms and the nurse. You are in charge.
That's right. You're in charge.
Yeah.
You're going to call the shots. You're going to let everybody know what direction we're going into. You're going to make sure you do your timeout and do it right, because you want to make sure they're operating on the right person, the right part, and so on and so forth. And you will be in charge of getting sutures and instruments and helping the scrub techs, and you'll run it. You will run it. You'll also be in charge of QBL, which is quantified blood loss. So you'll be calculating that also. Oh, anybody else have any questions for me?
I'm sure there's more coming.
I'm sure there are.
Yes.
I know you guys want to go into different areas of nursing. That's wonderful. I wish you the best, of course. And I'm sure you're all, what quarter is this? Are they in fourth quarter right now?
Yes.
Fourth quarter? Fourth?
Yeah, but next we're going to go to PEDS and other three.
Oh, good. You're going to PEDS. Oh, you guys are going to love PEDS. PEDS is fun. You're going to learn a lot.
We want them to go to the hospital and actually see a 2-year-old chasing them out of the room.
Yes.
Then they have to convince a 2-year-old to do assessment. I really want that, but well, COVID has got their own plans.
Oh,
you guys,
well.
any questions? Ask Miss Cory.
Anything else you guys want to ask me?
Yeah, she is, as I said, an educator and train all the nurses, labor and delivery, postpartum, all the certification. Can you go over like, how many certification for the OB nurse to have in order to work in labor and delivery?
Yes, you would need your ACLS and BLS. You would need your NRP, which is neonate resuscitation. You would also need your fetal monitoring, which is extremely important. And you would need stable. Stable is stabilizing an infant. Because remember, when you're in a delivery, you are the first responder. And if that baby comes out not breathing, it's your job to bring that baby back. So you would need all those certifications to work in labor and delivery. You would also know how to scrub. There's a lot of different hats you wear.
And that's why when you go to labor and delivery, you see nurses are wearing scrubs as soon as they get in there, because you never know if your patient is going to end up in the C-section. So you all be ready to go, yeah?
Yep, we're all wearing OR scrubs because you have to be ready to go into the OR at any time. I mean, you're presented with a lot of sick mommies that sometimes have insulin drips. Some of them even have cardizem and have to be on a telemonitor. I mean, there's so much you're exposed to in labor and delivery. And so many things you need to be up on. You have to know if mommy's abrupting, if mommy has a cord prolapse. That's a big emergency where you would actually have to keep that baby's head off the umbilical cord. And how would you do that? Is lie mommy down and put your fingers inside and hold that baby's head off that cord and feel it pulsate. And you would go into the OR and you would stay there on the OR table until they retrieve that baby from mommy. So you'd have to stay underneath there. You don't come out until baby's out.
Yeah, so we had a couple of scenarios that they saw the video from YouTube showing how the the nurse left their hands in there until the baby comes out. So
that's correct. You'll actually feel the doctor pull the baby from your fingers. So it's a very weird sensation, but you're saving a life. You want to make sure that that cord has all the nutrients that that baby needs, because the baby has to continue to be oxygenated during that time. It's all about that.
Yeah.
Anybody else have a question?
What was your most life-changing experience?
My life-changing experience for me, I became a nurse very late in life, and what was my life was actually delivering my first baby. The doctor did not make the delivery. I was there by myself with mommy, and she was premature. And there was no hospitalist. Anesthesia was not there yet. I did call for help, but I actually delivered the baby. And it was not my first. That was my first, but I went on to deliver many more after that. And it is a very life-changing event for you. It's just very special to feel yourself bringing a new life into the world and knowing what to do at that point, and being there for mom also, who's very scared and very nervous. And you'll learn how to be part of an epidural to help mommy with pain. You'll be with anesthesia for that, and you'll learn how to do that. You'll learn how to pull the catheter out. You'll learn a lot of different things in labor and delivery, which you would experience in the main OR or in a PACU or in a high-risk situation. Anything else?
We always.
What can you tell us about the hardest experience you had in your experience? What was the hardest time you have to pass through being a nurse?
For studying, for studying, or me as a nurse? My hardest experience.
You as a nurse.
Okay, so I believe my hardest experience was taking care of a high-risk mommy. We have a surgeon that comes from Miami. His name is Dr. Quintero. He's world-renowned. He actually does twin-to-twin transfusions in utero, and he also does shunts. He does a lot of surgery while baby is still inside mommy. That was the hardest thing for me to go through when I did a twin-to-twin transfusion with him, and taking care of mommy afterwards and losing one twin, which does happen. And that was very hard for me to go through, explain to mom. And thank goodness, mommy, one twin did survive. The other one did not make it. That was sad for me. It was a hard experience to go through after seeing the surgery and the success of it. But there's always that downfall. There's the pros and the cons. You have to go through both. And that was difficult. Anything else?
Thank you.
You're very welcome.
Anybody else?
Yeah, how is it right now with COVID? Like, what are you guys doing?
So for COVID, we do have COVID patients that come in and test positive. We have them in isolation rooms in a negative pressure room. Baby is delivered in the room. One nurse is assigned to a COVID patient. She will go in and out of that room. The baby will be delivered, and the baby stays with mom. We do not pull the baby from mom. Sometimes baby's tested to make sure baby is negative. Baby breastfeeds with mom. As long as mom is doing fine, we're okay with that. And usually that's been our experience right now with COVID. Everything's been fine. Mom has been okay. Baby has stayed in the room. So
I'm sorry, how do you test the baby for COVID? Is it the same way as everybody else?
it would be a blood test. It would be a blood test. They would take blood from the baby and test the baby. But we haven't even had to go through that, because 9 times out of 10, and we still don't know why, but mom can come in and test positive, give birth to the baby, and then test negative and not have COVID anymore, and not have symptoms. So we don't know why. We're still learning about COVID. We're learning about the different things about COVID. I don't think anybody can give you a straight answer as to why, yes, no, right, wrong, is this black or white? It's not like that with COVID. We're still learning about that. We're still learning about the virus. But I will tell you that moms come in positive and they leave negative with no symptoms. Any other questions? You're welcome.
Any other question?
What do you think are like the most challenging aspects regarding meeting your patient's needs?
The most challenging is pain, their fear, their anxiety. That is what you are there for. With your compassion, your empathy, and the main thing you want to do for everybody in the hospital is to make sure they're pain-free. When mommy's in pain, that actually causes a problem for baby also. So you want to make sure mommy is pain-free. This is supposed to be a happy experience for her. She's bringing a new life into the world, whether it's her first, her second, her third, her fourth. You want to make sure she's pain-free.
Thank you.
You're welcome.
It could be a 10th baby.
That's right. It could be her 10th baby. You're right. You're absolutely right. And they're all different. Every delivery is different. It's not the same.
Yeah, I'm glad you say that, because I always say, if you imagine you go to the hospital and they have all vaginal deliveries, different ages, but then still they're going to be all different experiences.
Yes, they are. Yes, they are. They are all different. No delivery is the same. No two deliveries are the same. That is correct. And you become part of that mommy's life because you brought her baby into the world. You helped. And that's a gift.
It is. It's a very good experience to be part of it.
Yes.
Everybody, when baby comes out and screams and everybody cries, including the nurses.
That's right, including the nurse. That's correct. That's absolutely right. Go ahead.
Can you tell them, like, for a new nurse who doesn't have the med-surg experience and wants to work in labor and delivery or postpartum or NICU, what are the things that they're in place to help them get up to speed and be able to work in labor and delivery?
If you choose to follow through with labor and delivery, A1 is a wonderful site to go on to find out evidence-based articles on the different types of things that we're learning about: postpartum hemorrhage, hypertension, chronic hypertension in moms, preeclampsia. You will find a lot of information about this. To get yourself started, if you wanted to take a basic fetal monitoring course, that would help you understand the blood flow in utero for baby and for mommy, maternal, and of course the fetus. If you want to go ahead and take an NRP class, it's very educational. That would actually help you immensely, give you more knowledge. It depends on your desire and what you want to do. As a labor nurse coming in, if you're novice, you're going to be trained. You're going to be with an experienced nurse that's going to help you through different things. You're going to experience the OR. So we give you bits and pieces as you progress. And we meet with you and talk to you and find out what your strengths are, what your weaknesses are, and we work on that with you. So we never took novice nurses onto the labor floor, but we are doing that now. And the educator, which would be me, would go ahead and set up a plan for you and teach you and train you and get you ready, because the first thing we want is patient safety, right? We want to make sure patient's okay, baby's okay, and you're okay, and you have the knowledge and the skills you need to do that.
Thank you very much.
You're very welcome.
So anybody who is going to volunteer, and then we just can hook you up with Miss Cory.
Yes, you come with me. And I'll help you out.
I know.
I have a love for what I do. So I don't look at it as a job. It's my love. It's my passion. And that's what I say to all of you. Find your passion.
Can you go over what things you do other than just being educator for women's health? Anything else that as a nurse they can do, become diverse, not necessarily just, as I said, just going to work at the job. What else things can do to enrich them?
You could volunteer at a clinic, which is very nice to do because you get exposed to a lot. For pregnant mommies, you could do that. You could also work as an adjunct professor somewhere and do clinicals for nursing students, which is wonderful in the area of your choice. There is so much open to you. You don't just have to go to work as a nurse, work your 3 shifts and come home. When you become a nurse, it's vast what you can do. I mean, put your imagination to it. You could do anything. If your passion is to help people and to be with people, that's what you do. You could go on missions. You could travel. Anything you feel that you want to enhance your education, enhance your future, anything's open to you as a nurse. Anything. Education-wise, working in different places, doing different things, helping people, volunteering, giving your knowledge and your skills to others. It's beautiful. It's a beautiful, beautiful profession. And it's built on trust, empathy, trust, and compassion.
I know we're making them go through shadow health and then making with the avatar,
Yes.
which is require them to do the empathetic things, like literally. But I mean, it's teaching you how to respond to a patient versus being mechanical, knowing the answer only. You have to go more than with the heart. And the care, this is the caring field, so you always have to put your heart in there. Acknowledge what the patient is going through, whether right or wrong. You have to acknowledge it, that you hear them, and then go and continue teaching them. So you have to be present for them. So
yes,
it's always,
absolutely.
Yeah, you mentioned it, I think, a couple of times, to be empathetic, because it does help.
Yes.
It gives you a role as a nurse there, being very, very helpful for the patient, definitely. Yeah.
Yeah. You guys have a wonderful professor. You don't know how lucky you are that you have this woman. She is awesome. She is awesome.
All right, thank you. Any questions for Ms. Cory?
No.
Yeah.
Well,
I wanted just to say before you run away, I do appreciate for the you gave us time to come and just give them a glimpse of labor and delivery. We really, really wanted to go. I mean, if it was my choice, we just go to the hospital and go and start chasing everybody, run through the C-sections. We always have so much fun when I went last quarter and she was there, and we were like running past each other. Go to that room. So just last thing before you leave, I want you to paint a picture of when the patients find the labor and delivery nurse in the triage. What are the things that they need to go through at that moment, and what the decision they need to make before calling the physician? Because I'm trying to make sure they get that review as for their final in 2 weeks.
Oh, okay. Triage. As a labor nurse, you would not do triage until you have at least 1.5 years experience on the floor. Triage is really using your critical thinking skills, because when mommy comes in and mommy tells you, oh, I have a little pain on the right side, or you know what, I have a little bit of a headache, you have to know what to do at that point. You have to know, okay, let me think now. If she tells you, you know what, I've had some spotting, some blood, your critical thinking skills have to take place into knowing, okay, is she abrupting? Does she have a previa? Is she starting the start of being preeclamptic? Get this baby on the monitor. Let me first see if this baby has nice accels, if the baby is well oxygenated. Let me test let me look at mom's vital signs. Let me see where she is right now. Let me palpate. Let me make sure I feel that baby move and mommy feels that baby move. All those things are important and play an important part. And your critical thinking skills have to be sharp. You have to be sharp and you have to act fast. Because if mommy is abrupting or there is something going on, let's say mommy's about to seize, you see her blood pressure's 250 over 200. And mommy is about to seize. You have to know what to do at that point and to call all hands on deck. You're going to call something called an OB stat, which brings everybody into triage for you. And we get that mommy back to the OR as fast as possible. But your skills, your critical thinking skills have to be sharp. And you have to listen to what mommy's telling you. Don't just say, oh, she's coming in here just to be checked, to look at the baby. No, listen to mommy. Mommy knows her body well. And she's going to give you clues and hints as to what's going on with her. So triage is extremely important. Anybody that wants the ER, if you work in triage, those are your skills. They must be sharp. Okay?
Thank you very much. Yes. Anything else? Taylor, who wants to go to ER? If you're in an OB ER, they do have ER in OB. Just
yes,
specific.
we have it. Yes. It's OB triage. We have our ER right there.
Yeah.
If you come into the ER pregnant downstairs, they're going to send you up to us.
Yeah.
They're going to send you up.
Yeah, you do need this unique skills for the OB.
Yes.
You're treating mom and baby as fast as you can. You at the same time, so you always have
Correct. You have
think-
2 patients.
sometimes 3.
Yes, exactly. Sometimes
Sometimes
3. That's correct.
Yeah, I do appreciate very much for your time, and thank you for coming and paint a picture of OB. And
Oh,
hopefully,
you're
1, 2,
very
3,
welcome.
5 people decide to be OB nurses. Yay! Then
Yay.
we find where she is, and then we move you along.
Well, I'm here for you. You know I'm here for you. If they have any questions, feel free to call. I would be more than happy to take them on.
Okay, so I'm going to give you the last chance to say final words. Because remember, she's a South University alumni, so we always want to make sure our South University name and integrity continues. So if there's anything that you can advise them as soon to be, maybe in 3 quarters, to be South University alumni, what is it?
I would say to all of you, lead with your heart. Know what's inside of you. Know who you are. Find out what your gift is for this world. Go into it this way, because you will never be sorry. You will always be true to yourself. And that will emanate to your patient, because your patient feels what kind of a person you are and what kind of a nurse you are. So remember that when you go into your field. It's not just a job. It's much, much more than that. You have people's lives in your hands. Remember that always, and treat them the way you would treat yourself and your own family member, always. Okay?
So everybody can stay
Bye,
back.
guys. Have a wonderful day.
Thank you
Yeah.
very much.
Thank
You're very
you.
welcome. Have a good day. Good luck to all of you.
Thank you.
Okay, bye-bye.
Okay, bye. Okay, so I hope she convinced somebody to be labor and delivery. I'm waiting to hear. But Sarah is already there, so we work with Sarah and try to help you along get there.
I mean, everything she said was pretty exciting, to be honest with you, but I still don't know.
No, but I mean, I think right now, yes, we are going by just listening, but it's unfortunate. If we guys will give you the experience, I guarantee you people will make a decision because they feel the sense of like being at the hospital and see what then, especially if they attended the surgeries or attended the delivery, and be able to see how the nurses are doing. And then maybe you do something, it's in patient wants you, then the nurse, then people are like, I want to come and work here. Because I mean, you have to feel and to be present in that area to be able to say, okay, I want to do this. So it's always very, very good.